Namaste. I am Dr. Shama Kadri from Faculty of Physiotherapy and Diagnostics, and today in this video we are going to talk about calcaneus heel bone fracture. So, calcaneus fracture is a fracture of calcaneus or heel bone can be painful and disabling injury. This type of fracture commonly occurs during in high energy events such as car crash or a fall from ladder. When the heel is crushed under the weight of the body, this occurs, the heel can widen, shorten, and become deformed. Calcaneus features can be quite severe. Treatment often involves surgery to reconstruct the normal anatomy of the heel and restore mobility so that patient can return to normal activity. But even with appropriate treatment, some fractures may result in long-term complications such as pain, swelling, loss of motion, and arthritis. The bone of feet are commonly divided into three parts: the hindfoot, midfoot, and forefoot. Seven bones called tarsals make up the hindfoot and the midfoot. The calcaneum is the largest of the tarsus bone in the foot. It lies at the back of the foot below the three bones that make up of ankle joint. These three bones are tibia, shin bone, fibula, smaller bone in the lower leg, talus, small foot bone at work as a hinge between the tibia and the fibula. Together, the calcaneus and the talus form the subtalar joint. The subtalar joint allows side-to-side movement of the hindfoot and is especially important for balance on uneven surfaces. Normal foot anatomy is together the calcaneus and talus form of subtalar joint, which moves the foot side to side in walking. As calcaneum fractures are uncommon, fracture of tarsal bone account for only about 2% of all adult fractures, and only half of tarsal fractures are calcaneus fractures. A fracture may cause the heel bone to widen and shorten. In some cases, a fracture may also enter the subtalar joint in the foot when it occurs. Damage to the articular cartilage covering the joint may cause long-term complications such as a chronic pain, arthritis, and loss of movement. Severity. The severity of calcaneus injury depends on several factors, including the number of fractures, the amount and size of the broken bone fragments, the amount each piece is out of place, that means displaced. In some cases, the broken end of bone line up almost correctly. In more severe cases, there may be a large gap between the broken pieces or the fragments may develop each other. The injury to the cartilage surface is in the subtalar joint. The injury to surrounding soft tissue such as muscle, tendon, and skin. When the bone breaks and fragments stick out through the skin, or if a wound penetrates down to the bone, the fracture is called an open fracture. An open fracture often causes more damage to the surrounding muscles, tendons, and ligaments and takes a longer time to heal. Open fractures have a high risk for infection in both the wound and the bone immediately. Immediate treatment to clean the wound is required to prevent infection. Causes are: the calcaneus is most often fractured during a fall from a height, twisting injury to the ankle, motor vehicle collision. The severity of a fracture can vary. For example, a simple twist of the ankle may result in a single crack in the bone. The force of head-on car collisions, however, may result in the bone being shattered. Similarly, fractures can result from different mechanisms. For example, if patient have land on the feet from a fall, body weight is directly downward. This drives the talus bone directly into the calcaneus. In a motor vehicle crash, The calcaneus is driven up against the talus if the heel is crushed against the floorboard. In both cases, the fracture patterns are similar. As a rule, the greater the impact, the more the calcaneus is damaged. In a high energy fracture, other injuries such as fracture of the spine, hip, or other heel can occur. In some injuries, the talus is focused downwards, acts like a wedge to fracture the calcaneum. The computerized reconstruction of the calcaneus fracture show the amount of damage that can occur. Symptoms: patients with calcaneus fracture usually experience pain, bruising, swelling, heel deformity, inability to put weight on the heel or walk. With some minor calcaneus feature, the pain may not be enough to prevent from walking, but patient can limp. This is because the Achilles tendon acts through the calcaneus to support the body weight. If, however, calcaneus is deformed by the injury, muscle and tendon cannot generate enough power to support weight. Foot and ankle will feel unstable and patient will feel differently. If we talk about the examination, it is that is an important part. We go through the physical examination. After discussing the symptoms and medical history, there is a careful examination. You should ask or examine the foot and ankle to see the skin was damaged or punctured from the injury. Check the pulse at key points of the foot to be sure that there is good blood supply to the foot and toes. Check if patient can move the toes and can feel things on the bottom of the foot. Determine whether patient have injury. Any other area of the body should be examined by the rest and injured leg and other leg, pelvis, and spine. The tests are X-ray. In X-ray, the test is mostly common and widely available diagnostic imaging technique. X-ray creates image of dead structures, dense structures such as bone, and X-ray can show if the calcaneum is broken or whether the bone are displaced. The CT scan is done. The treatment is planning of the treatment where you should ask the patient the cause of the injury, overall health checkup, the severity of the injury, and extent of soft tissue damage. Because most calcaneus fracture cause bone and to widen and shorten, and the goal of treatment is to restore the normal anatomy of the heel. Is in general, patients whose normal heel anatomy is restored have better outcomes. In most cases, recreating the normal heel anatomy involves surgery. Non-surgical treatment is done for immobilization. A cast, splint, or brace will hold the bone of the foot in proper position while they heal. Patient may wear a cast for 6 to 8 weeks or possibly longer. During this time, patient will not able to put any weight on the foot until the bone is completely healed. In surgical treatment, it requires open reduction and internal fixation. Fixation may be done by the screw. If we talk about the pain management, NSAIDs may be prescribed by the doctor. Opioid dependency or overdose become a critical public health issue. If we talk about the rehabilitation, whether the whether the treatment is surgical or non-surgical, the rehabilitation is important, where you include early motion, physical therapy, and weight bearing. The complications may include small or temporary area to delayed wound healing, nerve irritation around the incisions, tendon irritation, joint stiffness, chronic pain, chronic swelling. The major complications include failure of the wound to heal, infection, post-traumatic arthritis. So this was all about the fracture of the calcaneum. Hope you understand it well. This video is powered by digital version of 2.0 Jyoti Vidyapeeth Women's University. Namaste. खुश रहिए